My name is Dr. Cynthia Noguera, and I am an oculoplastic surgeon at LSU Health Shreveport. I attended medical school here, residency, and then went away for additional training in oculofacial plastic and reconstructive surgery. Oculoplastic surgery is a very subspecialized field within ophthalmology, doing all reconstructive cosmetic surgeries around the eyelids, the tear duct, and the eye socket. I am the only oculoplastic surgeon who's trained through ASOPRS in North Louisiana. The closest oculoplastic surgeons would be either in Dallas, Little Rock, or even in Memphis, Tennessee, which is where I trained. But now we have one here in Shreveport. Residency, it was definitely a challenge. You know, you're learning and you're growing. There's so many things, especially here in Shreveport. The amount of trauma that we see here, being at a level 1 trauma center, definitely makes for some of the most difficult and challenging cases. We definitely worked hard in residency, and ophthalmology is a very high volume specialty, so we're seeing, you know, a couple hundred patients in clinic sometimes at a day. I would definitely recommend the program here. I think we're have high surgical volume numbers, which I think is very attractive for anyone who's going into training, especially a surgical subspecialty with microsurgery such as ophthalmology. I do think one of the benefits now is having an oculoplastic surgeon here. Part of my job as an oculoplastic surgeon, one of my most favorite parts, is operating with a bunch of other different specialists in this area, such as ENT, neurosurgery. Having that collaborative and multidisciplinary approach, number one, it really is the best thing for the patient because we're also very well trained in our very niche subspecialties. But also I think the amount of exposure now that our residents are getting is a much different experience than what I had when I was a resident. So I'm happy to be part of that change.